Hello and welcome to another Complete Physio podcast. And I'm delighted to have with me today Matt Kent, who is going to be talking to us a little bit about skiing related injuries. So I'll let Matt introduce himself and his background and experience.
Yeah, hi, so my name's Matt Kent. I'm a specialist MSK physio, MSK sonographer, independent prescriber and injector now. And within my clinical practice, I have a lot of experience around ACL injuries, skiing injuries, knee injuries of that sort. So that's me.
Okay, excellent. Well, I'm going to start off by just asking you a little bit about what are the most common injuries that you tend to see related with skiing, would you say?
Yeah, so the most common injuries that we see are knee injuries. Definitely they account for usually about 25-30% of all skiing injuries. Within that, it's usually MCL and ACL. They're the most common. And that's just due to the most common mechanism of injury, which is usually that valgus rotation of the knee. Behind that is then shoulder, typically. And then we see sort of dislocations, fractures, AC joint disruptions. And then after that, hand and wrist, and then usually concussion, which obviously we don't deal with as much, but yeah, they're the sort of the main ones.
Okay. So I guess there we're talking predominantly about sort of like, traumatic injuries, yeah?
Yeah.
Any sort of other types of injuries that you might see commonly in skiers? Is there any sort of overuse, overload types of injuries or not so much?
You do get it. You do get it. But I think for most people, you're a recreational skier. You're only going skiing for a couple of days, a week, that sort of time frame. So you typically don't get those sort of overload issues because you typically just aren't exposed to it for long enough. So the majority of the injuries are more those acute traumatic cases. And typically it's that first day. So literally majority of people always ask, when did you do it? And majority of them are always on that first day.
Yeah. So yes,
which is never a good start to your ski trip.
Yeah. Okay. So listen, you're seeing these people. They may be post surgery sometimes, and I guess you're seeing a lot of these people after they've had their injury diagnosed, if you like. So this is sort of post trauma, sort of rehab. I'm presuming here. Yeah. Anything specific around the fact that they're obviously looking to get back on the slopes again, so anything particular to that?
Yeah, so I think skiing's a bit of a unique sport in a way where obviously to sort of go to the basics of muscle activity, you've got eccentric loading, isometrics and concentric loading, and skiing is probably one of these rarer cases where it's predominantly an eccentric sport. So you're going downhill and you're constantly trying to almost brake and resist that momentum to control your speed. So what we find is, from a training perspective, you need to be preparing your body and exposing your body to a lot of eccentric loading, a lot of isometric loading.
Just so, because I'm aware of the fact that there'll be a lot of people that listening that maybe won't understand what that. So what's eccentric loading?
So, in a simplified way, with eccentric loading, we're talking about loading the muscle under tension while it's lengthening and controlling that movement. And isometrically, we're talking about loading the muscle in a static position. Right. And we see the majority of skiing, as I said, involves those two muscle contractions rather than a shortening cycle, which you see in most other sports.
Okay. So that means the rehab has to sort of focus particularly on getting that particular sort of muscle activity back going again. And so talk me through then. So obviously ACL injury is a very common injury related to skiing. So can you talk me through the sort of specific nature of your sort of classic, you mentioned oftentimes multi-ligament injuries. Can you talk me through your sort of classic multi-ligament ski injury and then their sort of path back to the slopes again?
Yeah, so majority of them have had that acute trauma on the slopes. So they've usually twisted their knee. It can be due to a number of reasons. Binding's too tight, too loose, weather conditions, slope conditions, whatever it might be. If they've then had the surgery and they've had the ACL reconstruction, it is it's a long pathway. It's a long process back, and the majority are taking at least a year to get back on the slopes. Probably, I guess, to keep it sort of simple, if we're talking about more sort of end stage rehab and that preparation prior to getting back onto the slopes, as I say, the big focus for me is around that eccentric loading. And there's a few sort of key exercises that we like to sort of throw in for those patients. Probably my favorite one for them is basically a sled pull, or sometimes unpopularly, but a very good exercise is then doing almost like reverse walking on a treadmill with quite a steep incline. And
right.
Both of those, depending on what access you've got equipment to.
Yeah.
Sled pull is a great one, but not all gyms will have that, and most people don't have one sort of knocking around in their garage or anything like that. But those as exercises really replicate the ski position. You're getting into that nice sit back position, and you're spending quite a prolonged period of time within that eccentric cycle. So you're exposing your muscles and preparing your muscles very much for skiing again. And then we would look at a lot of plyometric training to, again, prepare for the twists and the turns that, the knee is going to be exposed to.
Okay. And just, again, so that people get an idea of this. So if you've done an ACL multi-ligament injury, we're talking, you're not going to be getting back to skiing probably until the following season. How long would these people be thinking of before they'd be back to, say, running or playing other sports?
So I think what we're sort of moving a little bit away from time-based criteria a lot more now to sort of functional sort of specific outcomes to guide us to those decisions. So I mean, traditionally you'd sort of look at maybe a couple of months before running, but we're now seeing sort of specific sort of strength outcomes that we need to see, knee control outcomes that we need to see that would guide us a lot more on when it's safe to return to running. So rather than just saying sort of 3 months or 4 months. So I tend to not really encourage patients to go back to running before 3 months, just because there's probably not a big need to do it unless there is a specific reason. So most of them will be around that stage, but some, if they're not hitting those targets in terms of strength, knee control, knee range of movement, it can be longer, and actually it can be 5 months, 6 months if they're not hitting those targets. And we see that generally just reduces the risk of re-injury, flare-ups, those types of things. In terms of other sports, again, anything that's going to involve cutting, twisting, change of direction, again, it's, for most people, it is around that 12-month mark. You can get back sooner than that, and you can get back at 9 months, but you start to then have that conversation of, is it worth getting back that soon? We know, again, the longer you generally leave these ACLs, the risk of re-injury just drops month by month. So unless there's something very specific to get back for, it's sometimes just better to just give it those extra few months. So you'd be looking at those sort of timeframes. Okay.
And you mentioned before about some of the sort of almost like intrinsic risk factors to do with skiing, in that, unless people are lucky enough to live in Milton Keynes and have access to a dry slope.
Guilty.
Is that why you moved there, Mal?
Oh, yeah, pretty much.
And for the dry slope. Then it is something, as you say, but this sort of takes us on to this whole thing around sort of injury risk, which, I find really, really interesting relating to particular sports. So we've got, with skiing, we've got baked into it that for most people, they are going to be doing it only, say, 1 week in 52, yeah? So that means for 51 weeks of the year, their muscles are doing something quite different a lot of the time to the demands of skiing. So in terms of injury prevention, is there any particular things that our skiers can do that will reduce the risks of that sort of first day on the slopes injury?
Yeah, absolutely. I think it's sort of a big gap at the moment where, there isn't a lot of research that's gone into this, but I think what we're seeing is it's preparation, basically. So a lot of people, as you say, they're skiing for 1 week out of the year. They're usually busy with work, looking forward to their ski trip. They finish work on a Wednesday, fly out, and then they're on the slopes Thursday. And not many people are doing specific training in the build up to that. And we know the demands that skiing is putting on the body. We know, there's been some really good work into looking at sort of muscle fatigue 24 hours after skiing and seeing quite a depletion of of muscle strength for, a good 48 hours post skiing. So building that endurance and fitness, giving yourself, I'd say probably a good sort of 4 to 6 weeks prior to that in terms of getting into the gym, focusing on some single leg eccentric work. That could be on leg press machine, knee extension machine, as I mentioned, sled pulls, reverse walking on a treadmill, some eccentric hamstring work, which could very much be single leg hamstring curls, Swiss ball curls, single leg RDLs, those types of things, and getting the knee used to some of the proprioceptive work that it's going to be exposed to on the mountain again can be really, really helpful. What we don't have is strong data to show the level of strength you need. So it's quite an interesting gap. So there isn't any real normative data out there to say you need this level of strength to prevent an injury on the mountain, but we're seeing if you can get that training into prior to going out, you're going to be in a much better spot when you're out on the mountain.
And I guess, again, it's one of these sports that, particularly as people might be getting a little bit older, to sort of build that into their, to their expectations and to their training. And, there might be a number of skiers that aren't doing a lot of sport at all the rest of the time. But then, suddenly for 1 week a year, they're traveling down the side of a mountain at very high speed. So as you say, it's got a lot of quite unique sort of factors about it, hasn't it? From a sort of injury perspective.
Absolutely. It's a very unique sort of level of fitness that you need for it compared to a lot of other sports. And the demands it places on your body aren't really comparable to the other types of sport that you'd be doing, say, in the UK on a day-to-day basis. So, having that little bit of specific training prior is going to be really, really beneficial in the long run.
Any advances, if you like, in terms of things like equipment or anything that you're aware of from a sort of protection and injury prevention perspective?
So, definitely just having the correct equipment is really, really important. And this will be more for sort of beginner skiers and people going out for the first time. I think the more experienced seasonal skiers will be aware of appropriate equipment. But, things like ill-fitting boots can be really problematic and lead to injury. Bindings that are too tight or too loose. So they're either going to come off too easily, which could cause you to fall. They're either going to not come off if you're having a fall, which can then lead to a twist of the knee. The correct skis, as a beginner, you're going to want slightly softer skis, which are going to be a bit more forgiving. As a more advanced ski, you're going to want stiffer skis because you're dealing with faster speeds. So that is, from an equipment point of view, just having that correct equipment and speaking, generally just speaking to a professional before you go out. So go to a ski shop if you're on the mountain, going to like a ski rental place and discussing sort of what you need. And then probably from the only protective side of things is around bracing. The jury's probably still out in terms of prophylactic bracing. So just wearing a brace, no history of injury, no issues, but just wearing the brace to protect from potential injury on the slope. There is some evidence to show if its efficacy. I think it's definitely not doing any harm. So it's not gonna be doing any harm wearing it. So this would be something that would stop your knee twisting, is that right? Yeah, trying to stop your knee twisting. So you've got a couple of options, and the simplest thing is just like a neoprene brace. 20 pounds, just give you a little bit of additional proprioceptive help around the knee to stabilize it and help with control. That can then go, and the world of bracing can get very expensive very quickly. And your sort of next tier up can be something like a DonJoy. One that I recommend is the sort of DonJoy Bionic, which is about 70 to 100 pounds and just has a little bit more stability around the sides. So it'll have some sort of some sidebars to it to again help with twisting. And then it can go up to hundreds and hundreds of pounds for things like an OSSA CTI Custom or CTI 3. They, as I said, prophylactically, the jury's probably still out. But in terms of functional bracing, if you've had an ACL injury, reconstruction, MCL injury, those types of things, we do see generally bracing after that does significantly improve your chances of avoiding an injury and does reduce your chance of re-injury. So
Okay.
The challenge is, though, the feeling of them. So they can be bulky.
Yeah.
It can be difficult to tolerate. So we do know they are helpful and they are protective. It's just sort of finding the right style for you and what you prefer.
Okay. Excellent. And so we talked a little bit about, particularly sort of lower limb injuries. Any sort of upper limb injuries that you tend to come across a lot with the skiers?
Yeah, so the shoulder's the next big one. So if you've not sort of twisted your knee, you've usually landed quite heavily on your side and your shoulder. And sort of the most common we then see is either a dislocation or some sort of AC joint disruption.
Okay.
Or in more extreme cases, a fracture. So they're sort of the next main one that we see.
Can you talk me through what a patient can expect? What's the journey for those sort of injuries, would you say?
Yeah, generally a little bit smoother and a little bit easier than sort of the ACL and the knee injuries. So sort of a shoulder dislocation or an AC joint disruption, you could be looking much more at sort of 3 to 6 months in terms of your recovery. Obviously it can be longer, but it's a lot shorter than that ACL journey. But can still be a challenging one long term. If you do dislocate the shoulder, there can be some ongoing issues there and risk of redislocation.
Yeah.
So again, a good rehab plan and preparation prior to skiing can again sort of reduce your chances of re-injury long term.
Okay. And you mentioned also fall onto the shoulder. Now, this is something that I have experience of because I ultrasound scan, as does Matt. And we quite oftentimes see people come back from skiing and they would have had a fall onto the shoulder. They have been told that there's no fracture. And then when we have a look with ultrasound, then we can sometimes see a small bony avulsion fracture. Can you just tell me a little bit more about that, Matt, and how that plays out?
Yeah, so I think the first thing is obviously getting that patient the right diagnosis. So typically an injury abroad is usually a quick X-ray.
Yeah.
Things are, they usually say no fracture or it's cleared, and then the patient comes back, and then obviously there's a lot of ongoing pain and discomfort. So I think getting that diagnosis is really key. And then again, in terms of an injury, it's not, in terms of the recovery timeline, it's nowhere near as bad or as long as something like an ACL. So with that sort of avulsion fracture, if it's something, quite small and it's, the displacement is not too big.
Sure. Yeah.
Within a couple of months, there's usually some good healing from that.
Yeah.
And then it's just a process of regaining that range of movement, building the strength and the proprioception control back into the shoulder.
So it's just really getting a diagnosis and them understanding why it's not recovering as quickly as they might have thought it would have done.
Because you wouldn't expect a shoulder sprain, you might sort of hope within a couple of weeks is settling. But if you find out there is some form of fracture in there, you're going to be a little bit more understanding that this is probably going to take a couple of months. Yeah.
And you mentioned wrist and hand injuries. Anything particular there for people to look out for?
Yeah, so again, usually it is just some form of acute trauma. So you're going to be holding onto your ski poles. Usually there's some form of sort of pull, twist, yank of sort of fingers, thumb that gets caught in the pole, gets caught in the straps. You're usually going to be obviously quite aware that you've done something to the area. Again, a lot of the time it's more of like a ligamentous type injury or potentially a tendon type injury, which on initial assessment with an X-ray usually again just gets cleared as no fracture. But there's usually then some ongoing issues. There'll usually be a decent amount of swelling, decent amount of bruising around the joint. So something's going on, and that's where, as you mentioned, something like an ultrasound scan can then give a lot more information, a lot more detail about the type of injury and severity of injury. So we'll be able to pick up on any sort of ligament disruption, tendon tear, and be able to just get a much more clearer diagnosis.
Yeah. And those ligament injuries around the thumb can be quite common,
Yeah.
And that is what, the pole just doesn't come out of the hand in time, or?
Yeah, well, basically, because you've got the strap, you usually have your sort of hand through the strap, holding onto the pole. So, you can basically just get quite unfortunate. The strap can get around the thumb, yank it. Also, there's like skier's thumb injury. The pole can just sort of pull back, or putting your hand out to brace yourself for a fall. Again, if you're on some sort of packed ice, icy snow, it can be quite hard, and it can just pull the thumb back into hyperextension and cause the injury that way. but they are much less common than your knee and shoulder injuries. They're the main ones.
Okay, that's fantastic. So there's a few sort of take-home messages that I'm getting from this, and that is that skiing is a very unusual, quite a unique in nature because of this whole, it's something that people might just do one weekend a year.
Yep.
It might be completely different in terms of any movement or exercise that they're doing the entire rest of the time. And therefore, people to really think about doing some prehab or some exercise, some preventative exercise to get themselves ready, particularly if they've been quite inactive between skiing holidays.
Absolutely. I think there's not many other sports or many other activities that quite replicate hurtling down a mountain at, sort of 30, 40 miles an hour.
Once a year.
Yeah.
So it's got lots of inbuilt factors. And some of these injuries, obviously they can happen very quickly and sometimes through, no fault of their own, a collision or anything of that nature. And you could be a very experienced skier and be unfortunate enough to be involved in a collision, and they can result in some, quite serious injuries that are going to require significant layoff from some other activities. So there's a lot to bear in mind, and and also consideration of some sort of protective equipment, making sure that you seek professional advice for, as you say, making sure that your equipment is fitted properly and that you're able to make the adjustments to your equipment properly. So a lot to sort of think about, really.
Absolutely. I think definitely the sort of my biggest thing would be the prehab prior to skiing. I think that's the biggest thing. I think getting some very ski specific exercises in 4 to 6 weeks prior to going is just going to be massively beneficial for your injury risk, but also your performance on the mountain, enjoyment on the holiday as well. Yeah.
Excellent. Well, thank you ever so much for that, man. It's very, very interesting. As you can probably tell, I'm a extremely occasional skier, retired from skiing, some might say. So it's really, really interesting to hear, all that information about skiing injuries, and just taking that real perspective on how it is a very unusual, almost a bit of an outlier in terms of how sports are. So thank you ever so much for joining with us, Matt, and sharing all of your knowledge with us today.